Hello everyone, Governor Kate Brown here. This has been our first week living under the Stay Home, Save Lives executive order I issued this past Monday. We are all supporting each other and working together to slow the spread of COVID-19 by practicing social distancing. I know it's difficult. Oregonians are known for our friendly, community-centered lifestyle. Staying home may feel strange. You might be wondering if you're helping. You are. I'm here to remind you that it's the #1 way you can serve your community right now, and I thank you. We want to empower people as we fight this virus, and as a part of that, we launched the second phase of our Stay Home, Save Lives public awareness campaign just this morning. The goal of the campaign is simple: to unite Oregonians to save lives. It also shines a light on our essential workers and the sacrifices they are making on the front lines of this situation. When you stay home, you help keep them safe, and they work to keep our state going. We created the campaign with some very talented people at Portland-based ad agency Wieden & Kennedy. The Oregon Health Authority and Oregon Health and Science University shared their expertise by providing information and perspective from doctors and scientists. The campaign will air on television, radio, and social media and online. It also launches on the heels of the Oregon Health Authority's newly released forecasting. This is just a model, but it currently shows that the social distancing measures we put in place in Oregon are expected to flatten the curve here and allow our health professionals and hospitals to provide health care without running out of hospital beds. Now, this is only a forecast, but the message is really clear. Staying home is a key part of our fight against COVID-19. We'll be looking to updates every week going forward. I'm also looking at different data sources to determine how effective our social distancing measures are. For example, we know that passenger traffic through the Portland airport is down 90%. We know that ridership on Portland's transit agency, TriMet, is also down about 80%. These are the kind of metrics that indicate we are reducing the transmission of the virus. Also earlier this week, the Oregon Health Authority released a statewide action plan that was developed by health officials from the entire state to dramatically increase our ability to treat people with COVID-19. The plan addressed several urgent actions necessary to expand the healthcare system's capacity as Oregon braces for a projected spike in new coronavirus cases. #1, medical supplies. We need to procure and distribute critical medical supplies. That includes ventilators and personal protective equipment like masks, gowns, and gloves for our healthcare workers. #2, beds. We have to optimize hospital capacity to make sure there is a bed available when it's needed. This includes adding up to 1,000 new hospital beds across the state. #3, doctors and nurses. We have to mobilize the healthcare workforce to respond to COVID-19. This includes removing barriers so that doctors and nurses from other states can work right here in Oregon. It will make it easier for retired doctors and nurses to help. We're also taking steps to organize volunteer healthcare workers so they can help where they're needed the most. Both the forecast and the statewide action plan are available on healthoregon.org if you'd like to read more. A few other brief updates for today. Our testing capacity has dramatically increased to over 7,000 tests in the past week. We now have several hospital labs in the state processing tests in-house. That includes OHSU, Legacy, Asante, and Kaiser. We received delivery of 140 ventilators from FEMA yesterday, which is a good start. Under certain circumstances, we'll be allowing self-services Oregon's gas stations. A gas station will require an attendant to be on duty unless and require social distancing policies, including hand sanitizer, to stop the spread of COVID-19. And starting today, the Oregon Health Authority has started posting the daily situational status report, what we call the SitStat, on its updated COVID-19 website. The SitStat is the detailed report our emergency response team uses to inform me and my team of activities over the past 24 hours. This report shows charts of available ICU beds, ventilators, and our personal protective equipment inventory. I really encourage you to check it out. That's it for now. This evening, I'm looking forward to a video chat date with some of my friends. I know many of you have creative ways of staying connected with loved ones and your friends right now, and are spending time outdoors while practicing social distancing. Have a safe weekend. Thank you all.